Good afternoon and welcome back to another episode of Up for Discussion. I'm your host for this afternoon, Gail Lewis. And joining me today as we spotlight a local group here in Queens are Elsy Mecklembourg-Guibert. I hope I didn't kill that name. And Phil Charles. Welcome to both of you.
Thank you.
Thank you.
Thanks for joining us here today on Up for Discussion. And today we're going to discuss your not-for-profit EMG Health Communications and all of the great work that you guys do in the community right here in Queens and of course also on Long Island. So welcome to both of you.
Thank you. Thank you for the invitation.
Oh, I'm so happy to have you guys here because I've heard about EMG Health Communications and I was always interested in exactly what you do, where you do it, and why. So let's just start right there. EMG Health Communications in Queens and also based in Elmont as well, Long Island.
Correct.
What exactly do you guys do at EMG Health Communications?
Well, our focus, thank you again for the invitation,
Thanks,
Gail. And thank you to all the people that are listening to us. It's going to be a great afternoon. We have a lot of information to provide you in a nutshell. But basically, we want to say that EMG Health Communication, EMG that stands for Educating Minority Group, started back in the late 90s. In fact, it was incorporated and it was funded in 1997, but we really got into the groove of it by late 1999, early 2000, with the advent of the AIDS epidemics.
So what exactly do you guys do? Health communication?
Health communication, we promote changes, positive changes, and we create a learning space for mental and physical health. So actually we're promoting wellness and health. We want to make sure that people know that they need to have their annual exam, not only physical exam, the eye exam, dental exam, and most importantly for the women and men as well, their breast health. They have to take care of their breasts.
And specifically in minority communities?
We want to target the minority communities. We are looking, we are really searching for the populations of newly immigrants. We are working with the Caribbean American woman, the Haitian American woman, the African American woman, but everybody else is welcome to call us to seek our resources through the nets or by calling us. So this is what we are aiming at, to ensure that people are healthy, they stay healthy, and they know what to do to remain healthy.
Now, Elsy, you're the founder at EMG Health Communications, and Phil, you're IT coordinator and also PR person. All right, and in that capacity, what's your day-to-day like?
So my day-to-day mostly involves just communicating all the initiatives that our organization has through any type of social media. So we have our Facebook page. You can go and search for EMG Health Communications right on Facebook. Come find us, like us, and you'll be kept up to date with everything that we have going on. We also have a website at emghealth.org where you can go, look at our history, look at the effects that we're making on the community, not just here in Queens, but also in Long Island and in Brooklyn as well.
All right. And Elsy, you mentioned you guys got started with the AIDS epidemic in the 1990s, and HIV is still one of your main initiatives right now.
It was very, very strong at one point, especially in the early 2000s, because the epidemics was at its peak. And so we really wanted to have the youth understand what it was all about and have them be aware, ensuring that they're aware of the informations out there, to be resourceful, and we wanted to help us as well reducing the incidence of the AIDS epidemic. And throughout the years, we realized that one of the best strategies to do is to educate the elders, or the families, or the pastors. And speaking of the pastors, this is when we had another initiative that started in 2003.
What was that?
We had a group with the AIDS program, and this is how we were going to try the training program, the workshop, the building capacity workshop. So in other words, we were going to provide the top one, the leaders of the community, and namely the faith-based leaders, with the information necessary for them to disseminate it through their assemblies.
Was there any pushback? I'm wondering, because you were working with the faith-based community and talking about HIV. Now, that there was a huge, especially years and years ago, we're talking about, there was a huge pushback because of the stigma, the social stigma surrounding HIV. How did you get around that?
Well, it had to be done intelligently, diplomatically. We started with with getting acquainted with the faith-based leaders of the Brooklyn community and the clergy, the Haitian clergy. And this is where we step our foot into. And at first, they were not adamant. They were not totally against it, but they were very cautious. They wanted to know what we were going to talk about, and we were sure that we were not going to do any kind of demonstration of any kind of sexual apparatus. So we agreed on that. And from the very beginning, the training that we had begun in 2003 with the group coming from Georgia. It was a religious group under the directorship of Dr. Jumani. She's a reverend, a doctor, PhD, and she came to train the faith-based leaders and giving them a 2-day capacity skill training and left us that heritage. So from 2003, we picked on that, and then we continued on this pathway. We're still doing HIV prevention. We're still telling the public, the young people, to be out there, that are out there, to be careful. But our focus now is on the elders, on the influential leaders that can also help us attain the goal.
Is that both faith-based and also other community members, or?
They're solely faith-based for the HIV/AIDS program. And recently we had our 10th-year anniversary, and Phil can tell you about it. We were
so
2013.
Of 2013. It was held at Centerlight Health Center, which is right in downtown Brooklyn. We had just a number of pastors and other faith-based leaders that have been involved with the program over the past 10 years. We came, we thank them so much for their help, not only in being such generous recipients of the information, but also doing their part to make sure that that the appropriate information goes out into the communities. And when we talk about that, we don't simply mean, okay, this is what HIV is, this is what AIDS is. That information people can get from a lot of sources, especially today.
So your focus instead is on?
So our focus is more on the interpersonal effects of it. So for example, a lot of communities place a certain bad stigma when someone is diagnosed with HIV/AIDS. They assume that they're involved with certain kinds of socially inappropriate activities, things like that.
Even today, people still make that assumption.
Exactly.
Absolutely.
When in reality, it's just an issue of catching germs, honestly. So a way that we go about making sure that the public knows that it's not just because of certain activities that you do, but literally it can be something like going into a nail salon that doesn't properly sterilize their tools.
Okay, so you would...
And if there's any blood exposed and you happen to come in contact with it, then there's a chance that you can catch it. So making sure that people, when they go to get their nails done, just use that same example, to just watch and make sure that wherever they're going does what they need to do, whoever has those establishments does what they need to do, and everyone working together will make sure that everyone else can remain safe.
So awareness all around.
Awareness and re-emphasizing hygiene, basic hygiene. Because at that point, after 30 years in the epidemics, we hope that people know the do's and the don'ts. But still, to reiterate to them that it's important to practice good hygiene. That's what is important.
And another one of your initiatives, in addition to the HIV initiative, is the Parent Initiative. Can you guys speak to that and why that, what exactly is that and why is it important?
Well, it's kind of intertwined. I mean, faith-based leaders are also
with the
the parents. So they have such a large community of worshippers. So we grab the parents now and the young parents as well, and we provide them with the skills of to enhance, or if they don't have it, we try to provide it to them at that point.
So parent
training skills.
So what are you teaching the parent?
Well, we tell them about the coming of the child. We start from the very beginning, child development,
when they're pregnant,
when the pregnancy, whether it was a wanted pregnancy or not, and when the child comes in, the child development, the child upbringing, the basic parent skills, being a tough parent, versus being a democratic parent,
Right.
besides being also a laissez-faire.
Right.
If you want to let the child grow up and do whatever he or she wants. And we have other topics such as negotiating skills, anger management, when parents are really above and beyond, they cannot really take it anymore. They need some sort of respite services. And taking five
Yeah.
as well. Discipline, which is
How
a
to
very
discipline your children.
absolutely. This is a very big issue into the minority community. So
How
we need
so?
because parents feel that they can bring their cultural belief or their cultural practices into mainstream America.
Right.
So we want to tell them, no, there are rules and regulations here, right here.
Okay, as opposed
And
to where
we
you
are totally
come from.
against that,
Right.
from where you are from and even there. So we provide them different ways, different methods into timeout. It's a good thing to do.
Right.
Timeout with a child that is perhaps tired, irritated. So we said the timeout is a good strategy to use. So we've had a very, very good outcome, starting with about 60 parents over. This is one of the longest programs that we've had, over
Really?
10 years. And we can say basically that we have educated over 1,000 parents.
Really?
Over
That's
1,000 parents.
tremendous.
Yeah.
So do you
we
guys usually do this in churches? Where do these
We do that
parents-
in churches, and we also can be called on at one of the agencies where there is a class, the evening classes.
Right.
Where we can go and provide a one-time. We can do a one-time seminar for the parents that are there. But the class is 12 weeks, and we do it at a church
Oh,
in
that's
the
great.
Cambria Heights region.
Okay. Where was the last one that you did? Do you
We
remember
finished
the
the
site?
one back in May. In May, and then they go on vacation, and we start again in October.
Okay. Where's the next one in October? Where's that one going
It
to
will
be held?
it will be held in Cambria Heights
Okay.
at Sacred Heart Church.
Okay, great. So if people want more information, they can always hit you up on that Facebook page as well.
Absolutely.
Exactly.
Okay, that sounds like a great. Is something like that. About how many parents do you get in a parent training program? Is it something that there's a waiting list, or?
No, we have basically about 20 to 30, the max, 20 to 30. So we can easily manage the 30 people session.
It seems like you guys have all the populations covered. You've got the HIV population, you've got parents, young parents, new parents, and you also handle the elderly. Can you tell me about that?
That's a big program, the BEEHC.
BEEHC,
which
and that stands for?
bringing education empowerment, education again, empowerment, to make sure that they have the skills necessary to deal with the issues, the social issues, and the health issues as well, for healthy changes. So ultimately, the goal is toward attaining good health, optimum health.
Optimum health as an elderly person.
We have a very good, dynamic program director.
And
She
who's
is a
that?
nurse. She's Miss Sangos, a nurse and nurse practitioner. She conducts this bi-monthly program at the church again for elderlies to provide them information on their basic needs. It's a different health topic that is discussed each time that they meet. And it doesn't really stay right there, because now that you find out about all the problems that
Right.
the elderlies are having, sometimes there is violence in the home, there's sexual abuse. And so
Right,
there's
violence against the elderly is
right,
one
abuse,
of those areas.
elderly
right.
abuse. So this is something that we want to touch on. This is an open session. We welcome everybody from the area, because our target area is basically Cambria Heights, St. Albans, Jamaica. But anybody else is welcome to come. Those programs are free, by the way. They are free. And so at that time, we can find out, we can certainly piggyback on certain problems that they relate to us, and then help them out.
Oh, that's
provide them with the
tremendous.
resources.
What do you usually focus on in these elderly seminars?
Hypertension, diabetes, for the health issues, and for the social issues. We can touch on the home, the family
Right,
home,
your surroundings as an elderly.
and the eating habits, which is
Very
very
important.
important. The eating habits. So just for them to be in tune with with the teachings that we have.
Oh, that's amazing. That's great. So you guys handle the elderly as well. And another initiative as if these three weren't enough, another initiative that
I'm going to let Phil talk about the woman population now.
is the breast cancer
The breast
initiative.
cancer.
Yes.
So how did that get started?
It's the second longest program since 2000. In fact, in 2010, we celebrated our 10th year anniversary with all the speakers that came to the annual conference. The breast health program, we call it the BHP, is for women essentially, because breast cancer is essentially a woman's disease.
Right.
Although men also, 1% of men are also at risk of getting it. And the program entails a variety of services, from counseling through education, resources, information, and being newly diagnosed with breast cancer, we can help you navigate the healthcare system.
Okay.
We know you have new laws, new acts now.
Right, new
the
healthcare laws.
Healthcare laws, and so people are not totally keen about those things. So we need to sit with them and tell them exactly. Some of them are uninsured.
Right.
So we need to direct them to some very nice
To free
funding
resources.
agencies that can help them.
So that would be for mammograms, for checkups.
Mammograms, sonograms, and a biopsy, and ultimately a surgery.
Wow.
We can certainly look for the resources for people that are underinsured or totally not insured.
And who's the director of this part of the program?
This is again Ms. Sangos.
Okay.
And under the directorship of Dr. Louis August, is our clinical director. And whenever there is a follow-up to do, he's the guy.
Dr. August.
Dr. August is the top of the top.
And is he also playing an integral role in your October event?
He's the one that puts together the annual event, the annual Breast Cancer Summit, Breast Health Summit. And this year will be our 13th anniversary.
Wow.
13th year.
13th Breast Health Summit this year in October 20th?
October 20th, yes.
And where is that going to take place? And what are you guys going to do on October 20th?
Okay, it will take place at Anton's, which anyone familiar with Queens Village knows exactly where it is.
Anton's in Queens Village,
in
on
Queens
Springfield,
Village.
right?
On Springfield, exactly. It is a brunch. It's about 4.5 hours long. We have a number of field experts from different aspects of the healthcare system that will come in and speak on different topics related to breast cancer, whether it's self-detection or things related to mammograms and other preventative measures, as well as what to think about, what to do if you happen to be diagnosed with breast cancer, and who to follow up with and things like that. In addition to not just being an education session and being a place to eat, honestly.
So have a nice lunch.
In addition to having a really nice brunch, right?
We also have at least one person that comes in from more of a motivational perspective. So, for example, this year we are going to have a person by the name of Mary Daniel.
Mary and Daniel.
Mary.
Just Mary. Daniel's her last name. She is a doctor of Haitian descent. She was unfortunately a victim of the Boston Marathon bombing.
So back in April, she was part of the Boston Marathon bombing.
Yeah, she was one of the victims and one of the bystanders right on the sideline, right by the finish line. And as most people that watch the news know, she and a number of other people were severely injured and in some cases killed by that. In her case, she happened to have lost one of her legs and the other one is badly damaged. She has a young daughter. She was living on I believe, second floor apartment, so obviously going up and down a walk-up is not so easy when you only have one leg.
Well, half, yeah.
So there are some life changes that she's had to make, and
a lot of adjustments.
A lot of adjustments overall that she's had to make as a result of that. But despite all of that, she's always been in good spirits. She's been obviously going to the doctor, having certain things reconstructed, learning how to walk again.
A prosthetic, I'm sure.
Exactly, things like that. I forget which issue off the top of my head, but she was actually featured on the cover of People magazine actually shortly afterwards, along with two other fellow victims of the event. And there are places online where people are collecting money for her to basically help her financially since she's not able to work so well anymore,
Right.
with the costs that are involved with continued follow-ups with her doctors, treatment, things like that.
Rehabilitation,
rehab,
yeah.
exactly, things like that.
Moving, she can no longer live in her second floor apartment, right?
Exactly.
Yeah, that's one of the
So-
things she has to think of.
Yeah, so just obviously a number of different changes that were unexpected. But with that, she's there as a motivational speaker. She's there to basically show, you know, just no matter what happens to you, no matter how unexpected
Right.
it is.
She's great. She agreed to come, you know, wholeheartedly, without any hesitation. I'll be there. I'll be talking to the woman,
Wow.
to your audience. I will be there.
She
We
sounds
feel
like a
that-
great motivator.
Yes, and that can attract a lot of people. And then we want them to come for the essence of the afternoon, but also
Right.
to
You
meet
mean to
Mary,
learn more about
to
breast health.
cancer,
Right.
but also to support, to give Mary a lot more support that she needs.
Right, and she's getting an award from you guys as well. Which award is that?
She's getting the JCS, the Janine Castagnol Séjour Award. Janine Castagnol Séjour is a woman of the community who lost her life to breast cancer many years ago. And when she was diagnosed with breast cancer, she did it, a woman in her late 70s, she did it her
Really?
way. She started researching, she started reading books about the progression of the disease. She started educating herself at such a late age. And she
Where
fought,
a lot of people might have just rolled over at that point.
she was a
and just
totally
given up.
different person,
Yeah.
totally different person, animated, willing to learn, willing to know what was going on into her body. And she fought the disease with courage and dignity. So when she passed, we asked her family whether if they wanted to let us use her name to give an award, a perpetual award under her name, to women that are survivors, women that have done something for the community, and women survivors, just like Mary is,
Yeah.
and motivational speakers. So we had a whole series of guidelines for people to receive the JCS award. So Mary will be receiving the 7th annual JCS award this year.
That's exciting.
Although we're very, very happy about that.
Yeah, absolutely.
Yeah.
She sounds like she's a deserving recipient,
Right.
and she sounds like she's going to be a great motivator,
Definitely.
Yeah,
especially
she's
to an
just-
audience of breast cancer survivors and their families and community members as well.
Right, right. We expect a lot of people, survivors, patients, newly diagnosed cancer patients, and young women as well, because the disease doesn't spare. Although the guidelines are not to have a mammogram that early anymore. Those are the guidelines of the American Cancer Society. But we feel that we need to let people know each year that they need to go for their annual screening. This
Right.
is very, very important.
It's the communication part of EMG Health
Right.
Communications.
That is right. Now you got it.
Right, and remind us again about the October 20th event, well, we know it's October 20th, but where it is and how we can get more information about that event.
Okay, so that event, the Breast Cancer Health Summit, the 13th annual one, is going to be held at Anton's in Queens Village, right off of Springfield. You can find out more information by going to our website at emghealth, as one big word, .org. You can also email us at emghealth, but without the vowels, so I'll spell it out. emghlth@hotmail.com.
Right.
If you happen to have an account on Facebook, you can also search for EMG Health there and find our Facebook page there. And or
phone
just
number?
Google it. The phone numbers?
The 516?
The 516-458-6517.
One more time.
516-458-6517.
And that's for more information about the October 20th event at
Yes.
Anton's, and also more information if people want you guys to come out and speak to their community groups and their church groups as well, yes?
That number, we can add also another one at 347-409-1362.
Okay, one more time.
347-409-1362.
Great. And on both of those numbers, they can contact you for
contact
more
us.
information about the event or about all the great work that you guys do in the community.
Thank you.
Yeah.
Thank you.
It's been such a pleasure having both of you here today. We're just going to wrap it up. But are there any closing thoughts that you guys would like to share with us about good health communication in the community?
Well, aside from it being very important, aside from organizations like us coming out and doing that, part of the reason why I personally was brought in was just to make sure that it's not just certain generations that are doing it. It's a good idea. Elsy and the group have done excellent work over the past 16 years. But we're looking to add more people into the game.
And specifically young people.
So specifically young people like myself. I'm in my early 30s. So anyone my age or younger, high school, middle school, whatever. Any of you can come, reach out to us. There are definitely things that we can talk about, outreach into actual high schools, actual schools, things like that, just to make sure that we cover literally every section of the population, from young children, young adults, senior citizens, men, women, everybody. We want everybody to be educated and helping educate each other about different aspects of health, since obviously health is the most important thing to all of us.
Right, your health is your wealth.
Exactly.
And if young people want to volunteer at any of these health initiatives, they can contact you as well?
Definitely.
And it's not just young people, it's anyone who wants to volunteer.
Anybody.
Okay.
Right.
And Elsy, final thoughts?
My final thought is that we're just one of many organizations, but we feel that we are pioneered, we are blessed to have started this program, especially the breast health program. Health, as you said, is your wealth. It's been done, it's known through the federal level. We see what Mrs. Obama is doing with the obesity issue, and we want also to be in line with all of those programs, all of those strategies to ensure that the community stays healthy and we don't have to spend those dollars, waste those dollars into the healthcare system. We want to do it now instead of later. Prevention is better than treatment. It's really costly. Medical care is very, very costly. Especially when you're not insured, now the big issue now is health disparities, is what you have, how they're going to be treated. So it's best to take it now than later.
Okay.
So we want to commend the population to listen to all the programs, to read books, to get themselves knowledgeable, and eventually to live a better and longer life.
Thank you, Elsy, and thank you, Phil, for joining us here on Up for Discussion today. For more information about EMG Health Communications, you can always go to their website, emghealth.org. And for more information from me, Gail Lewis, your host today on Up for Discussion, you can always feel free to email me, Gail Lewis, New Day 2010@yahoo.com, and that email address is newday2010@yahoo.com. And don't forget, if you'd like more information about EMG Health, to give them a holler, call them, check them out online, and of course on Facebook as well. Thanks for joining us on Up for Discussion this afternoon, and have a great evening. Bye-bye.